Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3, and welcome to this edition of DSM Insider. You know, one of the most common questions I get is, what do you do when a patient already has a dental device, they're doing well for treating their apnea, but now a tooth breaks and they need a crown? Well, my advice to that is, if you knew it ahead of time, then maybe we want to prepare before the patient comes in. One thing we can always do on our patients who may be at risk for breaking teeth or having future dental work is selecting a device with a material that we can easily adapt. My favorite for this is what we call thermacryl or AccuFit. Different labs call it different things, but it's basically the liner inside the device you can heat up and it can get soft and you can remold it as many times as needed. So if they have that particular material, then it's no problem. We just heat up that side of the device, let it get soft, and then we refit the device in the mouth. So I think the really question is, what happens when we didn't think ahead far enough and the tooth breaks and now the person needs to have a crown and they already have a dental device? Are we going to have to remake this device? What are we going to do? Well, the other thing is we think ahead on this as well. All of our patients, when we deliver a device to them, we give them the study models. Part of our instructions to them is to hold on to these models as long as you have this device. And if you ever need to have a future crown, whether I'm the dentist or they're going to a different dentist, they take those models with them and say, I would like this crown to look just like this model. And in which case the lab can, or they can do it in office depending on the technology, they can do a CAD/CAM replication crown and make it shaped just like the tooth was before. If all goes well, because you had that model before it broke, the lab can make it shaped the exact same, and when the crown's cemented, the device goes back in and you never know that anything was done. So that can save you a lot of time, and it's saved us a lot of time over the years. We've been teaching that for quite some time. Well, occasionally a patient comes back in and they've broken their tooth and they've lost those study models even after all of our good instructions. Well, I didn't really have a good solution until I got an email, actually a letter in the mail from one of our partner labs that we work with, DPS. DPS had a great idea, and I'm going to show you now how we can do that even if they've already lost the dental models or you never asked them to keep it. So again, here's all you have to do if you didn't happen to save a dental model and a patient needs a crown after already having a dental device. So all you need is some bite registration, impression material. Bite registration works fine. And if we were going to be replacing a crown here on number 30, all we do is squirt the bite registration material in the area and make sure we get a few teeth on either side. And we're just going to make a positive model of that area to send to the lab. And that can work as our working model that maybe we didn't have.
Good.
Okay, so we're just going to pull the bite registration material out, and you can see we've got a nice model to go to the lab. So the next time that your patient breaks a tooth and you don't happen to have the model like we hope the patient kept, then you can use this technique to do a replication CAD/CAM crown. Well, thanks again to our friends at Dental Prosthetic Services, DPS Lab, for that new technique. So now, whether we have the study models or not, we have a great technique to get our patients up and running again after having a crown. We don't have to redo their device, and they can continue breathing better and living longer. I hope this has been helpful. Thanks again for reading and watching this edition of Dental Sleep Medicine Insider Magazine.